The data that I'll be presenting at the SOHO meeting is from the data cut in September of 2020. We present data specifically on the CLL patients that were studied in the phase 1/2 trial. This is 170 patients for safety and then a slightly lower number for efficacy. The data overall look quite good for the drug in the CLL/SLL patient population. We see an overall response rate of 63%. Some of the interesting findings regarding the response rate is that for patients who are on the drug for longer periods of time, the response rate does appear to deepen with time. And so the overall response rate of 63% increases to over 80% for patients who are on the drug for 10 months or longer. The other interesting findings about the responses that we're seeing are that responses do not appear to be dependent upon various clinical factors. So some of the ones that we looked at were reason for prior BTK inhibitor discontinuation. So the majority of patients had had prior exposure to other BTK inhibitors. And so the response rate does not appear to differ for patients who did or didn't have prior BTK inhibitor exposure, nor do responses appear to differ based on the reason for BTK discontinuation among the subset that had the prior exposure, whether it was progression or intolerance. We also see responses across all risk factors. And so this was a pretty high risk population with a lot of patients having 17p deletion, TP53 mutation, and unmutated IGHV. We also don't see any difference in response for patients whether they did or did not have the C481S mutation, which makes sense with respect to the drug's mechanism of action, given that its binding is completely independent of the presence or absence of that mutation.